Hi, I'm Dr. Asit Arora. I'm the Director of GI and HPB Oncosurgery at Max Super Specialty Hospital, Saket, New Delhi. So, today we're going to talk about pancreatic cancer. It is one of the most lethal cancer known to human body. Pancreas is an organ which lies deep inside your tummy in its upper part over the spine. Now, the main function of pancreas is that it secretes insulin and glucagon, which are the hormones that manage your blood sugar, and it also secretes some enzymes which are used for digestion. Now, pancreatic cancer is the cancer which arises from the inner lining of these pancreatic ducts, and we call it pancreatic ductal adenocarcinoma. Now, since pancreas is located deep inside your tummy, in initial parts we do not get any symptoms, and by the time patient present to us, most of these patients are in advanced stage and unfortunately at times in stage 4. So, what are the symptoms of pancreatic cancer? So, like I said, to begin with, there are hardly any symptoms, and if there are some, they are so trivial that people tend to neglect them. Now, since pancreas is located so deep inside your tummy, unfortunately in the initial part of pancreatic cancers there are no symptoms. By the time symptoms arise, most of the time it's too late. What are the most common symptoms of pancreatic cancer? So, pain, which is situated in the upper abdomen and it radiates to your back, anorexia and weight loss, and at times jaundice, which can be increasing and it can be painless at times as well. So, these are the most common symptoms of pancreatic cancer. At very late stage, patient can present with distension of the abdomen due to fluid accumulation. So, pancreatic cancer has a slight male preponderance and it affects people in their 6th and 2nd decade of life. Now, there are some risk factors for pancreas, and the strongest of them is smoking and alcohol intake. Obesity and lack of physical activity are other risk factors. There are some genetic conditions like hereditary pancreatitis which can predispose patients to pancreatic cancer as well. So, how is pancreatic cancer diagnosed? If anybody has signs and symptoms which are suspicious of pancreatic cancer, doctors usually prescribe certain tests. Now, CT scan of the abdomen is usually the workhorse. Even a PET scan or a MRI of the abdomen is used to diagnose these tumors. There are some advanced tests available now like endoscopic ultrasound, through which we can even take small tissues, FNACs and biopsies to confirm this diagnosis. There are some tumor markers available as well like CA19-9 or CEA, which helps us in getting further information and closing the loop. Once the diagnosis is made and staging is done, the treatment part is proceeded on. So, the treatment of pancreatic cancer, like any other cancer, depends upon the stage of its presentation. So, if patient comes to us in early stage, surgery can be potentially curative. A patient who presents to us in a locally advanced stages, we would require some sort of pre-treatment prior to surgery like chemotherapy or radiation or both. And patients who come to us in the later stages of their illness, that is in stage 4, unfortunately chemotherapy is the only hope. Now, the soul of the treatment of pancreatic cancer treatment lies in the surgical management of it. So, you have to remove the tumor with a clear margin along with all the lymphovascular structure, and this as if now is the only potentially curative treatment available to us. So, like I said, surgery is the mainstay of treatment in pancreatic cancer. So, let's discuss in detail about surgery. So, pancreatic cancer surgery would require the removal of the pancreas, the part of pancreas where the tumor arises, along with the removal of regional lymphovascular tissues. Now, if the tumor is in the head of the pancreas, it will require the removal of pancreatic head along with the duodenum, the bile ducts, the gallbladder and the part of small intestine. Now, this complex procedure is called Whipple's pancreaticoduodenectomy, and when we remove everything, it will require a complex reconstruction. So, we will join the remaining part of the pancreas with the small intestine, that is the jejunum or the stomach, and we will also have to join the bile duct and the stomach to the jejunum to create the new passage for food. Now, this is a very complex procedure. Traditionally, we used to do these procedures with open techniques, But now of late in the tertiary care centers and highly specialized centers, we can also perform this procedure either laparoscopically or robotically. But so despite all its complexities, when this procedure is performed in good centers where these surgeries are done at regular interval with specialized HPB surgeons, the safety of this procedure is in excess of 98 to 99%. Though pancreatic cancer is a very deadly disease, but if detected early and treated well, we can cure a good number of these patients. Now, a complex procedure like Whipple surgery has been made absolutely safe for the patients in past few years using recent technology and advances. Thank you.